It's another day with the physicians where your health is our business.
Growth spurt will end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know is
You're welcome back to the Training Ultra on your regular program.
You see some children flickering lights and different things. So not everybody does.
The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness. Self-care is also the process of taking care of oneself with behaviors that promote health and active management of illness when it occurs. Developing a self-care plan can help you enhance your health and well-being, manage your stress, and of course maintain professionalism. Let's be honest, self-care is a bit like mindfulness, an overused and almost cringe-worthy eye roll of a topic. But then we are the physicians, where your health is our business. On today's topic, we'll be talking more on healthcare tips in difficult times. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be talking about self-care tips in difficult times. My name is Dr. Martina Agbere. As usual, I'm not alone. I have with me my regular co-host,
Dr. Ramona Yusuf Kadri. It's always a pleasure to be here.
We're going to be talking about self-care tips in difficult times. First and foremost,
We all need it.
we all need self-care. Like one of the guests said some time ago when she came, she said she doesn't want people to walk with their dirty feet on the palace, which is our mind.
Yeah.
So talking about self-care, what do you think is going on even in our environment now? When does one need self-care? Is it when everything is good and rosy, then you now remember to take care of yourself? Or when the things are hard, like I hear diesel is almost like 700 naira now?
But the truth is that self-care should be part of our lifestyle. And it's paramount that we must be intentional in caring for ourselves. Why? It's very simple, very logical. You cannot operate from a place of deficit.
Some people actually practicing self-care without knowing that they actually
Yes, because they think there's no name for it. They just think it's, this is me, this is how I want things to be. No, it is part of your self-care, and you must nip it on board and say, this is it. I have period that family members, if you call me at that point, I'm not going to pick your call. Because I want to sleep well, except it's an emergency situation. You know, and I prefer you sending me text. So one of my self-care tips when it comes to communication, a text message is easier for me than a call or a WhatsApp. WhatsApp is even my worst. It's a distraction.
I know that.
Distraction for me.
I actually can testify to that.
So, but a text and telling me I have a message for you on WhatsApp, I'll go check your name and feature and know what it is.
Okay, so from what the WHO actually did say, it just means that if one is not careful about one's own self-care, it can actually lead to disease.
A lot.
Yes, a whole lot.
A lot. You will be going. You can't satisfy everybody when you are not Niger jollof rice. That is it.
We have a guest. We have a guest that was going to handle self-care tips in difficult times. We'll be back after the short break. Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. Today we're discussing a topic that is very, very, very interesting, that has to do with you and, of course, my humble self, your family, your community, with everyone. If you don't have it, it means you have lost a great deal. We'll be talking about self-care tips in difficult times. Why in difficult times? We'll find out during the course of the program. With me here in the studio, we have our guest. She is Dr. Tolani Oyerinde. Dr. Tolani Oyerinde. She is a resident mental health physician and, of course, a member of that noble profession, the Medical Women Association of Nigeria, Lagos State Branch. You're welcome to our program.
Thank you.
You're welcome.
You look really,
always
really
a pleasure having you on board.
Thank you.
So we're going to be talking about self-care in difficult times. Self-care tips in difficult times. But before you tell us about self-care tips, before you go to the tips, tell us something about self-care.
Thank you. So self-care in itself, it doesn't mean me first. It means me too. As Dr. May said, it doesn't mean you are selfish. It means that you are putting yourself at the forefront so you can be able to give from a full cup. By way of definition, self-care can be defined as individual activities that you engage in order to promote your health, prevent disease or limit disease, and also restore your well-being. And these activities are either gotten from the information, good information from your physician, or from lay experiences. Probably you noticed one day that, oh my God, you began having palpitations and you've been stressed. And from there you realize that, oh, I have to take it easy. So that could be a lay experience. So these are ways that you get the self-care tips, not just on the internet, not from the right source. You have to get it from the right source. And that's why I said they are rather individual activities that are gotten from knowledge. And this knowledge are from either your physicians, they are gotten from real life researched and information that have been put to use and are working, and also from lay experience. So that's by way of definition. Self-care, it's a big deal, but it is an individual activity. It is you that is in charge when it comes to self-care.
So now we know, I love that definition,
Yeah.
you know, because it's true. Everybody just go and Google.
Google is a friend.
What if it doesn't work for you? You know, and if
What works for A doesn't like to work for B.
So why self-care in difficult times?
Yeah. So when we say difficult times to me may be different from you, apart from the general, you know. So difficult times can be transient. It can be something that is just for a week or two. Probably you are going through a heartbreak. You may be going through sudden loss of a job. And it can be something that can last for more than 3 to 6 months. Probably you lost a loved one and you are still grieving, because grieving is different for different people. It can also be from daily stressors. You may not even know when you get stressed. It may be from the task at hand, the job you have to do, or your deliverables at work. In such instances where there are some difficulties, and how some people know they are going through a difficulty may be from their body physiology reaction. That means you just notice that you have fever, you are tired, you have all the symptoms that look like malaria, and you go for a test and it's not malaria. Or some of us begin to douse different Google doctor. You begin to use all the substance, all the, will I call it, I would say substance because it's not prescribed by your doctors. So you begin to use everything from paracetamol to anti-malaria to antibiotics, and you still feel stressed after a week. It shows that there is something going on. It could be physical, it could be psychological, it could be otherwise. But we know that in such instance, you need the right information to be able to embark on your own self-care.
Okay, so at the beginning of the program, you talked about the sources where you can get self-care from the professionals. And I also want to ask, how about from the family, from parents growing up with the children? I think they're able to also imbibe some of these things on the children, how to take care of themselves.
Yes.
Okay.
Okay, so part of self-care is also personal hygiene. And we know from that, we know many parents would have taught us, at least you learn, the family is the first place you socialize. That's your first, socialization encounter. So you'd have learned hygiene, which is a big deal. Because in hygiene, it's not just about waking up, having your bath. It's also about learning to declutter your environment. Because sometimes, some of us, our environment is even a stressor. We probably have a lot of clutter, things you don't need, books that are just hanging everywhere, and they are not well arranged. So you learn personal hygiene, because in decluttering and also in knowing how to care for your own well-being, from simple things as brushing your teeth properly, to taking your bath once or twice a day, to proper ventilation in your home, to even your sleep hygiene, learning how to put, make sure that the TV is on, making sure your bed is for sleeping and not for reading or watching Netflix. Those are ways we learn those things from home, and also we imbibe these things as we grow up. So self-care is a big deal when it comes to healthcare.
Okay, so it's a big deal when it comes to self-care, right?
Yes, ma'am.
There, I'm sure we have some strategies.
Yes, please.
So what are these self-care strategies that are available?
Yes. So self-care tip strategies are like, they are like the things you engage in. As I said, they are individual activities you engage in. So that will include things like physical activity, exercise. Exercise in this form can be from your simple brisk walking, just about 300 kilometers to and fro, 3 to 5 times in a week. Depending on how you gauge it, you should have at least 150 minutes of exercise every week. 150 minutes of exercise every week. To jogging, to skipping, to swimming, whatever form of physical activity you're engaging is a strategy to self-care. Because in exercising, you can actually build good hormones, good natural hormones like endorphins in the body system. Sorry for using that medical jargon, but it's something that, you bring up healthy hormones in your system that actually can revitalize you. So that's one. We also have things like meditation. In meditation, you can decide to just embark on like mindfulness, as one of the hosts has said earlier. You just decide to reflect and kind of think back and engage in things like also gratitude. In this way, it's actually a way of helping your immunity and building a positive emotion. That's what meditation, mindfulness, and things like gratitude help you with. Also, we have things like healthy eating habits, reducing your salt intake. Those things are not going to be, you must not be forced to learn to reduce your salt intake when you're not hypertensive. You have to engage in it. You have to engage, because the number one cause of hypertension in blacks is salt. So you have to know that, you don't need too much at a particular age. You don't need to take so much of spicy things, so much of, I don't like to mention names. If I say suya now, the suya man can come for me. So you have to know that you don't need too much salt. You have to know you don't need too much of sugars. You have to know you don't need, things you need is more fruits, more vegetables, more hydration, water. We cannot overemphasize that. These are healthy eating habits. You should also engage in relaxation. Relaxation is personal. For me, I tell people, in a month, please write down 10 things you like to do to distress. And out of those 10, make sure you do 3. It can be from going to do your nails, to make your hair, to go to the spa, to go and visit your friend. It cannot be overemphasized. It's an individual activity and a self-care strategy. Also, things like social support cannot be overemphasized. You need it, whether you like it or not. We keep saying socialization. Human beings were created to socialize. The creator that created us did not create us in isolation. So it's very important we know that having confiding relationships or social support is very key for self-care, because in that way you can decongest your mind, you can gain others' perspective, you can think in a broader view. So in such ways, if you're engaged in activities, as I said, and also various medical tips that will be given to you by a professional, if you're engaged in all these individual activities that you can own and say, this is me, this is for me, and this is working for me, I can guarantee you that before you would fall ill, or before you would say, oh, you can't function because you are so stressed, then the difficult circumstance has to be beyond the ordinary.
We need to keep a date with the physicians out there. We want to keep a date with the physicians so we can hear what you have to say about self-care in these difficult times. How have you been practicing it? Let's hear from you. We'll be back after this short break.
The art of practicing the rules and regulation put in place to be practiced in order to maintain good health.
Self-care is when you prevent yourself before the appearance of any disease into your body.
Self-care is what you do to prevent any sickness or a disease, any sickness that you know that maybe you're not feeling fine, you're having a symptom, you go ahead and prevent it. Take something that will prevent it.
Yeah, my self-care strategy is that whenever maybe I walk in the sun, or maybe I trek too much, I know that after trekking, I'm expecting a result that can be a sickness. So what I do is when I get home, I cook small leaves and I drink it to suppress anything that is coming to my body.
A lot. Time will not permit me to enumerate on all. First and foremost, personal hygiene is one of them. Apart from personal hygiene, we also have what we call environmental hygiene. Taking care of your environment, making sure of cleanliness of your environment, and all the rest that has to do with your environment. Your personal health care has to do with regular bath, brushing of your teeth normally, twice a day, and each time you eat, make sure you rinse your mouth to remove the food particle from your teeth to maintain good teeth gum, and also use toothpaste with fluoride. Wash your hand when you visit toilet regularly with soap and sanitizing. Now we are in a COVID-19 era. So to stop the spread of disease, that COVID-19 and all the rest, abide by the rules of complying to the rules of COVID-19.
My self-care strategies is like, for instance, when I wake up in the morning, I went and take a cup of water. After drinking it, I know that the water will go through my system and I will feel healthy.
You eat healthy food, balanced diet. Then you do also exercise. And if you are growing old, maybe you are up to 60 or and above, you don't need to engage yourself in jogging.
Exercise yourself. You get up, you exercise yourself, move around. For instance, you go for gym.
That one is very common with me. I'm a footballer, so I trek from 2 bus stops, go and come back, and I've been doing it for many years, and it's very good for me.
Welcome back. If you have just joined us here onto your regular program, The Physicians, where your health is our business. Today we've been talking about self-care in difficult times, and Dr. Tolani Oyerinde has been discussing it. So let's go back to Dr. Tolani. We were talking about setting boundaries, and of course the advantages of setting boundaries then. So you want to tell us more about these setting boundaries, how people can go about it, because it simply means that you are going to actually step on setting toes.
As people may think you are wicked.
So, and of course, most times even on your phone, you will see no calls, WhatsApp only, busy as their status. Is it that these people actually have decided to set their boundaries like that? Or jet calls only as such things then? Just tell us.
Okay. So to go to boundaries, it doesn't just have to do with just your personal life.
Yeah.
We have things like in finances, there are boundaries. We have things like in relationships, in marriage. There are various ways to set boundaries. Number one, what this helps you with it helps you to respect yourself and be in control. That's the first thing you should know. You're not being selfish. You're only trying to say, me too, I matter. Because if you go out and you find out that you cannot, give out of an empty cup, as Dr. May and Dr. Egberen has said earlier. So it's very important we know in boundary setting when it comes to your personal self, you have to know what works for you. Being self-aware. Who are you? Being self-aware. What agitates you or what makes you uneasy? Some people, Lagos traffic makes them uneasy.
Don't go there.
In short, they are already destabilized. Some people, many things can make you, the fact that you may get home and you have to put on a gen and you don't like the noise of gen, there are many things that can make you uneasy. So setting boundaries in many facets of your life can help you manage others. For example, you can say at 9 p.m. or latest 10 p.m. I must be asleep. You can't get home and keep working till 12 a.m.
And when you get home at 10 p.m., what happens?
When you get home at 10 p.m., you should know no matter when you set the boundary that you're going to sleep by 10 p.m. If you are getting home at that time, you should know what you need to do is take a bath, take a light meal, and you go to bed. Whatever you have to do, you have to shut down. Because what you are looking at with setting boundaries is preventing yourself from being dysfunctional when it comes to your personal health, your psychological well-being, or even your output or productivity. Because if you don't have the proper sleep, for example, when it comes to rest, you can even become irritable. Some people are irritable out of lack of sleep, lack of proper sleep. You're supposed to get at least 6 to 8 hours of sleep. For teenagers, 9 hours. But if, for example, and children, we know they can sleep more than half of the day for babies. But if you are not well rested and you are someone that goes to work Monday to Friday, you have so much on your desk, you just can find yourself very irritable. And that is one reason some people cannot even be well productive at work, because then you can lose concentration also. So it's very important when we say boundaries. I can't set your own boundaries. You have to set it. You have to know what works for you personally. You have to be self-aware. Because when you are self-aware, you can then be able to get to self-actualization. It doesn't happen by just, it's a process. Everything is a process.
So now we now know that this is not an event, it's a process. So, and we're talking about self-care tips in difficult times or precedented times. What can happen if you don't take care of yourself?
Yes. So many things can happen if we don't take care of ourselves. Many things. Apart from, we know the number one, diseases. Disease is dis-ease. So you're at ease. Then you become dis-ease. That means you're no more at ease, you're no more comfortable. So diseases can happen from every part of the body system, from the physical body system, poor hygiene. You can have scabies. You can have pityriasis versicolor. Sorry for saying that medical jargon again. It's just like the one we call eczema on your skin due to over sweating. I'm not a dermatologist, but because I've experienced it, I'm telling you out of experience. If you don't take care of yourself, due to there's natural flora on the skin that due to heat, everything, you don't not take care of yourself well, you can just have it and notice, this is not my real skin. So hygiene is important. That's where I'm going to. So things that you can see, you need to have various diseases, even abdominal discomfort if you don't eat properly, from the peptic ulcer disease, even to gastroenteritis, purging. We just say, we're in traffic, we just eat anything, or you eat from one mama puts, you can begin to purge. Even to hypertension from taking soft drinks every day. Some people don't have time for their personal, they don't even have a schedule on what is healthy, what is not healthy, what should I eat. So maybe you're eating a lot of carbohydrates from all sorts, from the buns to the meat pie to everything, and that's what you take every day. You don't take fruits in one day in 3 weeks. You should know that you are not helping your body system. With time, you are building unhealthy fat, you're also building sugars. So let's not leave physical, even psychological. Some of us, we know that most of our illness can be psychological. I have experience where I went to the hospital because I'm a physician. Doesn't mean we don't have our own stress or we don't fall ill. And I'm like, I am stressed, doctor. I know this is malaria. And the doctor did a test. I'm like, you don't have malaria. Your full blood count is okay. In short, you don't have any disease. I'm like, but the symptoms. And then I realized, like, are you sure you're not stressed? I'm like, look at me. I'm even a physician. I don't even know I'm stressed. Then I looked and looked. And I took a break. I rested. I went back to my self-care routine, and I did not use any medication. So psychological stress, from work-related stress, deadlines, even to various, relationships. I heard Dr. Maimuna teach one day and mentioned having good confiding relationship, even with your partner. So some of us women, maybe you're fighting with, you are not happy with your partner. that can be a stressor. It can be a difficult time. Financial issues can be a difficult time when you're trying to meet up with finances. Even economic issues, which we cannot control. You know, some of them cannot be controlled.
Even the country.
Even our country. I don't like to go into the country because I'm not vast in politics. So I would not like to go into anything politics or
politics. It's our reality It's our reality.
So for the reality,
look at the traffic. Look at the traffic. No lights. These are all stressors.
So looking at the fact that the economy can also be, and you cannot control that. You cannot control that because the economy can go this way or that way. So there could be difficulties all over. Electricity issues. People can say, oh my God, I have to pay bills, I have to do this. There are so many children issues which can fall into psychological. Probably your children, your concerns, schools. Difficult times can come, loss of a loved one, you know, where people can actually totally break down and not be so difficult times. But the most important thing in self-care is that you have to practice it as an individual early enough, because it builds you to an extent that when the difficult times come, or peradventure a stronger one comes, it won't tear you to the limit of, you know, either you becoming bedridden or you being able to function at all. That's the good thing about self-care. Thank you.
Very much, Dr. Tolani. It's always a pleasure having you here. We have all been schooled. Like I have decided, self-care is it. Setting of boundaries, that is it. Is the way to go. So thank you so much, and it's nice having you again on our program, and I'm sure we will call you again to come and tell us more from your field or your expertise. So self-care is very, very important. And again, thank you for keeping a day with us on the Physicians, because your health is our business. My name still remains Dr. Martina Agbeni.
Thank you very much, Dr. Oyerinde. That's been an amazing, amazing discussion. Self-care, I'm big on it, and I'm unapologetic about how to maintain my self-care. And please, kindly follow us on all our various social media platforms: Twitter, Instagram, Facebook, YouTube. And if you want to ever be a part of this, our lovely show here, you are just a click away. Send us an email. I remain Dr. Memuna Yusuf Kadri. Until next time, stay blessed.
Hello, my name is Dr. Chinyere Uzodimma, consultant pediatrician and pediatric cardiologist. Keep watching The Physicians.
Andrew is man. Now, when you think of it, Andrew, pause to stop.
Okay.
So
something has to stop the man.
Something has to stop the man, and the testosterone is the one that stops the man.
So what's that?
You are a man because testosterone is in you and it's working.
Maybe before you start, you tell us about testosterone.